Often focus on the big players in the skeleton. The femur, the skull, bones doing the heavy lifting or, protecting our brains.
The glamorous ones.
Exactly. But today we're going deep on a bone that is just absolutely fundamental to how we move.
But often overlooked.
Totally overlooked. It's just called the collarbone. We're talking about the clavicle.
It really is.
Yeah.
Most people, like you said, only think about it when someone breaks it skiing or something.
Right.
But mechanically, structurally, even how it develops, it's one of the most fascinating bones we have.
So what's the mission for us today? What are we trying to get across?
Simple, really.
Yeah.
We want to unpack this crucial bone, understand why this often ignored piece provides such a vital connection.
Connecting the arm to the main body, right?
The entire upper limb to your axial skeleton.
Yeah.
It's the nexus, the hub for force, for movement, even protection. It's complex.
Okay, let's kick us off with something really striking. A key fact that just screams, this bone is different.
Ah, yes. The big one.
The clavicle is the only long bone in the entire human body that lies horizontally.
That's it. Think about that.
Everything else, humerus, femur, finger bones, they're all vertical. Built for bearing weight downwards.
Compressive forces.
But this one runs sideways. Straight away, that tells you its job isn't about holding you up, it's about structure, reach.
Exactly. It's built sideways to hold everything else out, to brace it. It's fundamental to our ability to interact with the world.
And that horizontal position, that kind of sets up the whole mechanical puzzle, doesn't it?
It really does. Why is a sideways bone so critical for us, for upright primates? That's what we'll figure out.
Okay, so let's really unpack this. The slightly odd sideways bone. If you're tracing your own right now.
You can feel it right under the skin.
Yeah. And you notice it's not just a straight stick, it's got a definite curve, a very elegant one, actually.
Absolutely. That shape is key. It's distinctly S-shaped. That's its signature.
Not just curved, but S-shaped.
Precisely. And we need to be specific about that curve. If you look closely, the inner part, the medial half.
Towards the chest.
Right. That part curves forward. It has a medial convexity forward.
Okay. Bulging out slightly.
Then, as you move out towards the shoulder, the lateral half, it reverses. It develops a concavity forward, so it curves gently backward.
Ah, so it's a double curve? Like a shallow S laid on its side?
Spot on. And it's not just for looks. It's pure engineering.
For resilience.
Absolutely. That S shape dramatically increases its ability to handle compression and bending. Think of like a leaf spring or an arch bridge.
Okay.
That shape allows it to absorb and distribute stress efficiently.
Yeah.
If it were straight, same material, same thickness.
It would snap much easier.
Much easier under bending forces.
Yeah.
That double curve is built-in shock absorption.
And its location, you mentioned, right under the skin. Makes it very exposed.
Extremely. It lies subcutaneously right at the base of the neck, running across. You can palpate the whole thing.
Which is great for doctors, maybe less great if you fall on it.
Exactly.
Yeah.
Clinically useful, biomechanically vulnerable. No muscle padding to speak of right on top.
And size-wise, it feels quite small.
Relatively, yeah. Roughly 12 to 15 centimeters in adults. Not huge, but as we're seeing, functionally massive.
No, we called it a long bone earlier, but you hinted it's different. This is where the paradox comes in.
This is one of the coolest things about it. You know, typical long bones, humerus, femur, they have a shaft, two ends, and crucially, a medullary cavity.
Right, the hollow center for bone marrow.
So the clavicle. It basically says no thanks to that. It does not possess a complete recognizable medullary cavity.
Really, no hollow center. But it's a long bone taking load Why is it built differently?
That's the key question. If it were built like a femur, thick, compact bone outside, hollow inside,
It'd be great for standing for heavy vertical loads.
exactly, static forces. But the clavicle's job is different. It's about dynamic force dissipation and acting as a rigid spacer or strut.
Okay. So what is inside it then?
It's mostly spongy bone, cancellous bone. Think of it like a really dense, intricate mesh.
Like a high-tech foam?
That's a great way to put it. A porous, shock-absorbing lattice. And this is covered by only a very thin shell of compact bone.
So when you fall on your hand,
That shock wave hits this spongy network and gets scattered, absorbed across this complex 3D structure. It doesn't travel down a rigid tube.
wow. So it's designed to absorb and distribute impact differently. Less about weight bearing, more about handling shocks and holding position.
Precisely. It's highly unusual for a long bone and speaks directly to its function as a strut and force transmitter across all sorts of angles.
Okay, so this bone is the bridge, connecting the supermobile arm to the, well, relatively static torso. That means it needs solid anchors at both ends.
Absolutely critical anchors. Let's start medially, the end closer to your breastbone, the sternal end.
This feels like the main anchor point.
It is. It's the connection to the axial skeleton, and it's built like a tank, really. Noticeably rounded, bulky, designed for a solid pivot.
And what does it connect to exactly?
It articulates with the manubrium sterni, that's the top part of your breastbone, and importantly also with the cartilage of the first rib,
Forming the
sternoclavicular joint, or SC joint.
And that joint, despite how much we move our shoulders, it feels incredibly stable. You don't hear about SC joint dislocations that often.
You really don't. It's remarkably robust, which is crucial because it's the only bony attachment holding your entire arm and shoulder girdle to the rest of your skeleton.
Wow, the only one.
The only one. If that joint goes, the whole limb is essentially disconnected, structurally speaking.
So it needs to be strong. And presumably a major site for muscle attachments too.
Huge anchor point.
Yeah.
Our sources really highlight this. On the front surface, the anterior surface of this sternal end,
Yeah.
you get the origin of the pectoralis major muscle.
Pec major. That's a powerhouse muscle for rotating the arm.
Exactly. When you push something heavy, do a push-up, the force anchors right there on the clavicle.
Okay, what about the top?
Superiorly, along the top edge, you find the attachment for the sternocleidomastoid muscle, the SCM.
The big neck muscle you see when someone turns their head.
That's the one.
Yeah.
Very powerful, involved in turning and flexing the neck. And that muscle's pull becomes really important when we talk about fractures later.
Okay. And the back surface, the posterior side, what's happening there?
That's where its protective role really comes into play. The posterior surface of this sternal end lies right in front of some major structures.
Like what?
Large blood vessels of the neck. Specifically, the subclavian artery and vein, carrying blood to and from the arm, and even the top of the lung.
So the clavicle acts like a shield for these vital structures passing underneath into the armpit area.
Precisely. It highlights that protective function. Trauma here isn't just about a broken bone. It's about potentially life-threatening damage to those vessels or nerves. The integrity of the clavicle is key.
Okay, let's shift out laterally now, towards the shoulder point, the acromial end. This looks completely different.
It really does. It's distinctively flat. A real contrast to the bulky sternal end.
And why flat?
That flatness allows it to perfectly articulate with the acromion of the scapula.
The acromion being the highest bony point of the shoulder blade.
Exactly. The very tip of the shoulder. And this connection forms the acromioclavicular joint, the AC joint.
Ah, the AC joint. That one you do hear about getting injured. Separated shoulders and whatnot.
Very common injury site, yes. So you've got this sturdy, rounded hinge medially anchoring things centrally, and then this flatter, more gliding joint laterally.
Which allows the scapula, the shoulder blade, to move more freely.
Exactly. It facilitates that complex gliding and rotation of the scapula, which is essential for full arm movement. The flexibility of the shoulder relies heavily on this AC joint.
And muscles out here must be controlling shoulder movement.
Key shoulder movers attach here. On the anterior border of this flat lateral end, you get the origin of the powerful deltoid muscle.
Deltoid, that's the main muscle lifting your arm out to the side.
Correct. Abduction and flexion. Then, on the posterior border, you have the insertion of the trapezius muscle.
Traps, stabilizing the shoulder blade, pulling it back.
Elevating it, rotating it, yeah. So the clavicle at this end is like the staging ground for all that dynamic shoulder and upper back muscle action. It manages that transition from sternal stability to scapular mobility.
Okay, we've done the ends. What about the shaft, the main body of the bone? If you feel it again, there seem to be two distinct surfaces, top and bottom.
There are. And the difference tells a story. The superior surface, the top one, it's noticeably smooth.
Why smooth?
Mostly because it's subcutaneous, like we said, right under the skin. There aren't massive ligaments pulling directly on that top surface.
But some muscles attached there. You mentioned SCM, deltoid, traps.
Parts of them do originate or insert along the borders of that superior surface, yes, but the overall texture remains relatively sleek compared to underneath.
Ah, okay. So let's flip it over mentally. The inferior surface, the bottom. Anatomists always describe this as rough.
Universally described as rough, yes.
And I'm guessing that roughness isn't random. It's all about grip, about anchoring things.
You are absolutely right. That roughness consists of specific bumps, lines, and grooves markings for incredibly important ligaments.
The ligaments that hold everything together.
Ligaments that anchor the clavicle down, that suspend the entire weight of the arm from it, that stabilize the whole shoulder girdle. This is where the heavy-duty engineering is.
Okay, let's dive into these markings. They sound critical, like the hidden load-bearing structures.
They really are. We need to talk about the coracoid-clavicular ligament complex. This is probably the most important suspension system for the shoulder.
Okay.
Near the lateral end, the flat end, there's a distinct bump. That's the conoid tubercle.
Tubercle meaning a small bump.
Exactly. And it's specifically for the attachment of the conoid ligament. This ligament runs sort of vertically.
And its job.
It resists the massive downward pull of the arm. It basically stops the scapula and the entire limb from just dropping straight down relative to the clavicle. It handles huge vertical forces.
Yeah, like a suspension cable.
Kind of, yeah. Then, running laterally from near the conoid tubercle towards the AC joint, there's a ridge or a line. That's the trapezoid line.
With the nodular.
The trapezoid ligament. This one is positioned a bit more horizontally.
So if the conoid stops it dropping down, what does the trapezoid do?
It primarily resists horizontal shearing forces and prevents the scapula from swinging too far backward or forward under the clavicle.
Okay, so conoid handles vertical, trapezoid handles horizontal shear and rotation.
Together, these two parts of the coracoid-clavicular ligament form this incredibly strong V shape that suspends the scapula and therefore the entire arm from the clavicle. Massive stability.
Which is why when athletes talk about a separated shoulder,
they're often talking about tearing these specific ligaments. An AC joint separation usually involves rupture of the coracoid-clavicular ligaments. The severity depends on whether one or both are torn and how badly.
that makes so much sense now. It's the suspension system failing.
Precisely. It's a battle between the bone breaking or these ligaments tearing.
Are there other markings underneath?
Oh, yes. Right around the middle of the inferior surface, There's a definite groove, the subclavian groove,
Where?
dedicated entirely for the insertion of a small but important muscle called the subclavius.
Subclavius, under the clavicle.
Exactly. It runs from the first rib up to this groove. It acts like a dynamic cushion or stabilizer for the sternoclavicular joint during big arm movements and might help protect the vessels underneath.
Like a little muscular shock absorber.
Kind of.
Yeah.
And one more key feature, back near the sternal end. There's a distinct rough patch, an impression for the costoclavicular ligament.
Costo meaning rib.
Right. This ligament tethers the medial clavicle directly down to the first rib's cartilage, provides extra security for that crucial medial joint.
Man, the underside is just packed with connection points. It really is like a mounting bracket.
It's the perfect analogy. Every bump and groove has a critical anchoring function. And we see the muscle attachments continuing along the borders too.
Like the pec major.
Right, the anterior border, especially that medial convex part, gives origin to a big chunk of pectoralis major. And the posterior border, especially the lateral concave part, provides attachment for the trapezius. Every bit is utilized.
So pulling all this together, the shape, the ends, the surfaces, the ligaments, the muscles, what is the clavicle's main job, its functional mandate?
Okay, number one, absolutely primary function. It acts as a strut.
A rigid spacer.
Exactly. Think of it like the bar on a coat hanger holding the shoulders out. It physically holds the upper limb away from the trunk. Without that strut action,
Your shoulder would just collapse inwards.
it would slump forward immediately. You'd lose huge amounts of arm motion, reaching out, throwing, overhead movements. They all rely on the clavicle maintaining that width. It maximizes the lever arm for the shoulder muscle.
It gives you that range of motion. Okay, function one, strut. What else?
Function two, force transmission. It's incredibly efficient at this.
Yep.
Any impact on your hand or arm.
Like falling.
Falling, catching something heavy, pushing. Those forces get transmitted rapidly through the clavicle's S shape to the axial skeleton, to your core. It acts as both a conduit and a shock absorber.
And sometimes it absorbs too much and breaks, right?
Right.
Sacrificing itself.
Often, yes. It's designed in a way to fail at a specific point before that force damages the more complex shoulder joint or travels up to the neck and head.
Okay. Strut, force transmission. What's three?
Three is protection. We touched on this. Protecting that vital neurovascular bundle, the subclavian artery, vein, and the brachial plexus nerves as they pass under it into the arm.
Forming a protective roof.
Exactly. Its integrity is crucial for keeping those lifelines safe.
And then you have muscle and ligament attachments as separate functions too.
You could list them separately, absolutely.
Mm.
Function 4, muscle attachment site for major movers like pec major, deltoid, traps, SCM. Function 5, ligament attachment anchor for critical stabilizers like the coroclavicular and costoclavicular ligaments. It's doing a lot for such a small bone.
Okay, this next part. This is where the clavicle story just gets wild. The timeline of its development is completely counterintuitive.
It really is. It breaks all the rules for bone development. It's both a sprinter and a marathon runner.
How so?
Well, fact 1. The clavicle is the first bone in the entire body to start ossifying, to start turning from membrane or cartilage into actual bone.
The very first, before the big leg bones, before the skull really gets going.
Before pretty much everything else. We're talking super early in fetal development, around the 5th to 6th week of intrauterine life.
Wow. Okay, so the body prioritizes getting this strut in place really early on. That kind of makes sense structurally. Gives the developing arm bud something to anchor to.
That's the logical thought, yes. But here's the kicker, the paradox. While it's the first to start, it is simultaneously the last bone in the body to complete ossification.
Wait, what? First to start, last to finish.
Exactly. It doesn't fully mature, doesn't completely fuse all its parts until around 25 years of age.
25. That's years after most other bones are done. Your long bones finish in your late teens, early 20s usually.
Correct. So you have this bone doing all those crucial jobs, strut, force transmission, protection, and technically it's still under construction well into your adult life.
That is genuinely surprising. So what does that mean practically? Having a bone that's still maturing in your mid-20s, is it weaker?
It means certain parts, specifically the growth area at the sternal end we'll discuss, remain cartilaginous and potentially more vulnerable for longer. While clavicle fractures are common at all ages, an injury in someone aged, say, 18 to 25 could potentially involve that late closing growth plate.
Could that affect growth?
Less likely to affect overall length significantly by that age, as most growth is done, but it could complicate healing. Biomechanically, it suggests that the sternal end, that main anchor point, needs a really prolonged period to fully adapt and solidify to handle the immense forces generated by fully developed adult muscles.
Okay, so how does it actually form then? This start early, finish late process must involve some unusual methods.
It does. It actually uses two different types of bone formation, which is highly unusual for one bone.
Two methods.
Yes. It starts its main shaft development using two primary ossification centers, and these follow membranous ossification.
Membranous. That's like how the flat bones of the skull form, right? Directly from connective tissue, no cartilage template.
Exactly. It's a faster way to lay down bone. Think of it like quickly putting up the basic framework. So it uses this flat bone method to get its shaft established rapidly in the fetus, even though we classified it as a long bone overall.
Quick start. Okay. But that doesn't explain why it finishes so late.
Right, because there's also a third ossification center, a secondary center. And this one appears much later, specifically at the sternal end.
The bulky end near the chest.
Yes. And this secondary center uses cartilaginous ossification.
Ah, the normal long bone way, where you have a cartilage model that slowly gets replaced by bone.
Precisely. That's the slower, more gradual process. And it's the final fusion of this cartilaginous secondary center at the sternal end that takes so incredibly long, often not completing until the mid-20s.
Because it's a hybrid. Fast membranous bone for the shaft early on, slow cartilaginous bone for the crucial medial anchor point finishing much, much later.
That's exactly it. It's a true developmental hybrid, perfectly reflecting its unique structural and functional demands and explaining that bizarre timeline.
Given everything we've said, its exposure, its role as a rigid strut, the huge forces it handles it, really stands to reason that when things go wrong mechanically, they often happen right here. Let's talk fractures.
Clavicle fractures are, unfortunately, incredibly common. Top of the charts for broken bones, especially in active people, kids.
Why so common? Just the location and function?
Primarily, yes. It's subcutaneous, so direct hits land right on it. And it's that first line of defense transmitting forces from the arm. It's often the point of failure, designed to break before the shoulder joint itself gets disrupted.
And they tend to break in a pretty predictable spot, don't they? Like there's an engineered weak point.
Overwhelmingly, yes. The most common site is the middle third of the bone, or sometimes described as the junction between the middle and lateral thirds.
Right, where those two curves meet.
Exactly. That transition point between the medial forward curve and the lateral backward curve, that's where bending stresses concentrate.
And the usual cause.
Classic mechanism is a fall onto the outstretched hand or directly onto the shoulder point. Force travels up the arm, hits the clavicle, and it snaps at that structurally weakest point. Foosh injury, fall on outstretched hand.
Okay, so the strut breaks. What happens to the pieces? This is where those muscle attachments we talked about come back into play, right?
dramatically so. Understanding the displacement of the fragments is pure applied anatomy. When it breaks in the middle third,
Yeah.
you typically get two main fragments. The medial fragment, the piece still connected to the sternum,
Gets pulled which way?
it gets pulled upward quite significantly by that powerful sternocleidomastoid SCM muscle attaching to its superior edge.
Ah, the SCM yanks it upwards towards the neck.
Exactly, like pulling up on a tent pole. Meanwhile, the lateral fragment, the piece connected to the shoulder and arm,
What happens to that?
it gets pulled downward and often a bit inward or forward.
By what?
Two main forces. One is just the simple dead weight of the entire arm hanging off it. Gravity pulls it down. The second is the pull of the pectoralis major muscle, which tends to pull it down immediately.
So you get this classic picture, inner piece up, outer piece down, and often overriding. Causes that visible deformity.
That's the classic presentation. Medial fragment high, lateral fragment low, often with shortening of the shoulder girdle. That displacement is why many clavicle fractures, especially if significantly displaced, might need surgery to realign and stabilize them.
Makes perfect sense now, seeing how those muscles act on the broken pieces. Okay, shifting from breaks to problems from the start, congenital issues. What if this strut doesn't form right in the first place?
There are conditions where that happens, and they really highlight the bone's function. One is congenital pseudoarthrosis.
Pseudoarthrosis meaning false joint.
Exactly. The bone starts to form in two pieces during development, but they just never fuse together properly. So you end up with movement, like a joint right in the middle of the bone where you absolutely need rigidity.
Wow, okay. And then there's the even more dramatic condition.
The one that really drives home the strut function is cleidocranial dysostosis, or CCD.
Cleido meaning clavicle.
Yes. It's a genetic condition affecting bone development, particularly the skull, cranial, and the clavicles, cleido. Often, individuals with CCD have either completely absent clavicles or they're severely underdeveloped hypoplastic.
And the result, if you don't have those struts,
The visual consequence is striking. Because there's nothing holding the shoulders out laterally, the person can bring their shoulders incredibly close together in front of their chest.
like actually touch their shoulders together at the front.
Sometimes nearly, yes. They can approximate their shoulders dramatically inwards. It's the ultimate visual proof of the clavicle's primary role as that lateral strut. Without it, the shoulders just collapse medially.
Incredible. It shows exactly what that 12, 15 centimeter bone is doing for our posture and arm function.
It really does. That small bone makes the difference between our wide range of motion and having shoulders basically hunched onto the chest.
Lastly, clinical relevance in terms of procedures. Does the clavicle serve as a landmark?
Absolutely crucial landmark because it's so fixed, so easily palpable right under the skin, and because we know exactly what lies beneath it.
Clinicians use it to find things.
Exactly. It's a key guide for procedures like subclavian vein puncture. That's when doctors need to insert a central line, a catheter, into a large vein for giving medications or fluids long term. They use the clavicle to help locate the subclavian vein safely underneath it, and also for brachial plexus blocks. Anesthesiologists use the clavicle as a landmark to inject local anesthetic around the brachial plexus nerves to numb the entire arm for surgery. It's a predictable position, makes it a reliable signpost for accessing those deep, critical structures safely. Hashtag tag tag Shadow 7. Outro.
Wow. Okay, what a journey into what most of us just call the collarbone. Before we wrap up, let's quickly recap the main takeaways for everyone listening. The clavicle is vital. 5 key functions, right? 1, it's the strut, giving width and leverage for the arm. 2, force transmission, moving impact from the limb to the trunk. 3, protection for those crucial nerves and vessels underneath.
4, muscle attachment for big players like pec major, deltoid traps, SCM. And 5, ligament attachment, anchoring the whole system with things like the corticoclavicular ligaments.
And connecting that back to its unique features.
Remember, it's technically a long bone, but it breaks the mold. Formed mostly by that fast membranous ossification, but finished by slow cartilaginous fusion. It links the stable sternum to the mobile scapula. It's a hub for those muscle forces we listed, anchored by that sophisticated ligament system. And clinically, remember that weak spot, the middle third, where it most often fractures.
So reflecting on all this, you have this relatively small bone right under your skin. It's the only bony link for your entire arm. It governs your ability to reach, throw, interact with the world. And yet, it has that incredibly strange development. First bone to start forming, but the absolute last one to finish, way out at age 25.
Which leads to a final thought, maybe.
Yeah.
Knowing that your strut, your collarbone, is technically still finalizing its structure well into your mid-20s.
Yeah.
And knowing its internal design is porous, perhaps meant to fail before other things do.
Makes you think.
How often do we just take its strength for granted? Yeah. Considering the massive dynamic forces it handles every single day, every time you reach, lift, or even just brace yourself, it's a tiny bone carrying a huge lifelong responsibility.
A mighty, slow-fusing strut indeed. Fantastic deep dive.
Always fascinating.
Thanks for joining us. We'll catch you on the next deep dive.